So venous leakage is a common cause of erectile dysfunction, but as such, venous leakage is a very rare condition to have. Most of the times, the venous leakage is reported in the penile Doppler study because the study is not done properly. Either the dose of the medication is not given adequately, or the patient does not get the right environment for the test, or does not stimulate himself adequately. So what happens is when the erection is not proper and the patient does not get an adequate hardness, then the venous channels remain open. So the blood really does not stay inside and it keeps leaking in a certain way, so that on the reports it looks like a picture of venous leakage. So venous leakage as such is usually common only in patients where there's a history of trauma, or if they're old patients with diabetes and other conditions. Now in this particular case, the gentleman had come to us with erectile dysfunction with an established venous leakage, which means that on 3 penile Doppler studies we had already had the similar reports. Only in one of those the value was little less, but in reality the value of leakage of the velocities of the veins was more. And then we confirmed the same with the Koiver-Nosogram, wherein we put in a dye and then we took an X-ray and understood if there was any localized leakage, but it was a diffuse venous leakage. And in those conditions, we first tried to give some medicines, but when they did not work, we offered the patient with something called the penile implant.
I had this accident problem for the last 1 year, and I tried to have sex, and then I consulted some andrologist in Bangalore, and he has insisted to take this penile Doppler test, and after that has given some medicines for erection. I tried that for almost like 2 or 3 months, but still that didn't work. And after that, some 4 or 5 months, I left. I didn't take any like medications or anything. Then I came to a doctor and he diagnosed that some infection or something like Maggie like that. And we tried that medicines, and addition to that, I guess prescribed some action medicines also. It was like almost 4 months since I met him, and after that, he suggested to take that penile Doppler with the premixtures. In that, I came to know that I had this venous leakage. Since there is no like treatment for that, I had opted for this penile implant. The firstly, he has shown some malleable implants. Inflatable implants is like out of my like budget, so I had to choose between this Indian and imported. Between these two, I chose Indian. First one is the cost is less, and also it is more flexible than the other implants. I came to know that imported implants can be bent only like in bidirections, up and down. Since this was more flexible, I thought it would be comfortable. Also, so I chose Indian implant. Airtel extension is more common, and it's not like if you have this, you don't have any other option. Once I came to know that this Indian implant, I chose Dr. Talwar, and last 3 days back I had this surgery, and it was so comfortable. The pain is also like very less only. I would recommend this Jyoti Hospital for this kind of treatments. This pain implant is like the last option if the medicines does not work. And choosing this implant will be the most toughest like things before the surgery. I would suggest to have a word with doctor and to choose the best implant for like every individual is like different, and yeah, to have a word with doctor it will be best. Come in person to doctor and choose the like correct implant. You have to make your mindset like the life before this surgery will be different, and you have to like make some lifestyle changes and all. Like you have to deal with the already selected one. The spontaneous, like I am like happy with the implant, and the sizes are like exactly before this problem I had. I'm still like figuring out how to like limit this.
So whenever the patient comes to us, we try to offer them all the implants. We show them all the implants one by one so that the patient can make the best informed decision. But there are many factors which are playing in the head of the patient. There are maybe financial things, there might be things around the patient's daily activity, what they like to do, and they would imagine the various situations and then make an informed decision. So in this case, the patient took a decision to go for the Indian penile implant, which is again a very versatile penile implant. Definitely the decision to go for a penile implant surgery is not an easy one, because there are many fears in the mind of the patient. Although from my perspective, I feel that most patients who have undergone implant, they have no problem with the implant as such, and most patients would not regret the decision. They are able to do most of their activities, almost all of the activities. But still, when you are a patient and you do not know exactly what is going to happen, there are a lot of fear of unknown, which we support by giving our advice. As a doctor, we always try to tell the patient about our experience and what we have seen in the last couple of decades as urologist and somebody who has been doing or assisting in penile implants. So at every step, we try to be a support. We try to expel all the doubts, fears, and we try to encourage the patient to choose the right path to the final healing. So at every step of the way, we try to expel all the fears. We try to guide the patient, and we try to give them the feedback based on our experience and motivate the patient to choose the right treatment.